My name is Dr. Edgar Salas. I am a gastroenterologist here at E. McDowell. Been here a little bit over a year, and I also function as their only and first interventional gastroenterologist. Colon cancer is very important in the gastroenterology field and surgical field because of how devastating it can be. It starts off as small growths, tumors in the colon that when they get to a certain size can invade into the actual muscle of the colon and develop cancer. Currently, amongst all men and women, colon cancer is actually the third leading cause of cancer in all of America. Amongst all men and women, it's actually the second leading cause of cancer death in this country. Screening for colon cancer is very important because we can prevent and cure all colon cancer. It is started nowadays at the age of 45 with the new guidelines published last year, and all three major societies in this country have pushed this intervention. Colon cancer can be detected very early and can be cured also very early by different methods. These small tumors called polyps in the colon can be removed by a simple colonoscopy, which is an outpatient procedure. Some small cancers and tumors in the colon can also be removed here at E. McDowell using a method called endoscopic mucosal resection, which is an outpatient, non-surgical procedure. Colon cancer can also be cured by surgery. All patients over the age of 45 should be screened for colon cancer because it is being identified in younger and younger patients every year. Patients at even higher risk are those with family members who have had early colon cancers or early colon polyps detected. Here at E. McDowell, we've identified it to be our mission to eliminate all colon cancer in our community. Colon cancer screening should be done very early, starting at the age of 45, and for those at high risk. Colon cancer is identifiable very early and curable very early, as long as we do our part to be screened very early. So I encourage our E. McDowell community to begin this.
My name is Katrina Colossi. I'm a general surgeon here at E. McDowell. I've been here since November of 2020, and my husband and I live here in Danville. Direct Access Colonoscopy service is a way for our patients to call and have their colonoscopy scheduled, or to go online and fill out a form for a screening colonoscopy. The biggest benefit of direct access colonoscopy is that it's much more efficient for our patients. Patients can go online and have their colonoscopy scheduled, whereas before they would have required a referral from a primary care physician or would have had to come into clinic to see a provider first. Those who qualify for the Direct Access Colonoscopy program are any healthy asymptomatic patients aged 45 to 75 with average risk of colon cancer, healthy asymptomatic patients with a family history of colon cancer, adenomatous colon polyps in a first-degree relative, healthy asymptomatic patients with a personal history of colon polyps who need to repeat a screening colonoscopy. Individuals who do not qualify if any of the following apply: age 75 or older, weighing over 350 pounds, pregnancy, artificial heart valves, a history of lung disease that is steroid or oxygen dependent, a history of sleep apnea, history of heart attack, angina, or severe congestive heart failure in the past 6 months, a history of a bleeding or clotting disorder requiring anticoagulation medications, patients with automatic implanted catheter defibrillators, or those who are insulin-dependent diabetics. If any of these apply to you, please schedule an in-office consultation with a gastroenterologist or general surgeon before having a colonoscopy. Colonoscopies are performed either by a general surgeon such as myself or a gastroenterologist. The day prior, patients are asked to take a prep to clean out their colon. The day of the procedure, they're given what's called monitored anesthesia or sedation. And after the patients are nice and comfortable, a camera is inserted into the colon to look at the internal parts of the colon to make sure there are no polyps or precancerous lesions. Most of the time they can be. I'm able to tell patients right after their colonoscopy if any polyps or lesions were removed. It takes about 3 to 5 business days for the pathology reports to come back. Those patients are usually asked to come back to clinic for a follow-up visit, or they're given a phone call with the results. Yes, definitely. So someone can sign up for a direct access colonoscopy by going online and filling out a form. If you're not comfortable completing the online form, please call 859-239-5871.